Yeah.
Hi, we're here live today at the Florida Electrolysis meeting here in Embassy Suites in Altamont Springs. We are cleansing the patient's face right now with PriyanaMD VersaCleanse. This is a glycolic and salicylic face wash. It does have aloe and green tea, licorice, the witch hazel is built in, as well as some panthenol B5. Today we're going to be showcasing a popular treatment in the aesthetic practices, which is VersaPeel, which is a no downtime, non-active peeling exfoliator with the cool lifting treatment from Cryo Concepts. So we're going to show you some of the combination therapy treatments that are available to you today, and you can go online to PriyanaMD.com or Cryo Concepts to find one of our offices or electrolysis that are using these treatments. So right now we wash the skin. Now we're going to apply VersaPeel. VersaPeel has 5 acids and 2 skin lighteners. It is a glycolic acid, salicylic acid, lactic acid, azelaic acid, and kojic acid. It also has skin lightener arbutin. Arbutin is similar to hydroquinone, but it's natural. So arbutin is known to reduce melanin, stop the tyrosinase from the skin producing dark spots, and it is a really effective skin lightener. So VersaPeel Makeover in a Bottle is really going to help to exfoliate the skin. Our purpose for doing it here is that we want to exfoliate the skin, reduce some of the dead skin cells that are on the surface of the skin so that we can go into our cool lifting treatment and have more effective treatment. We're just combining 2 products that we know work very well to get the best treatment possible. So right now she's just massaging VersaPeel into the skin. And this is something that you can do in an office. VersaPeel can also be done at home. It's a self-neutralizing product, but you will also rinse this off with water. We'll leave this on the patient's skin for 2 minutes. If the patient is sensitive, they're going to leave it on for 30 seconds.
So if you have rosacea?
If you have it's not necessarily developed for rosacea.
Okay.
But if you have rosacea, you could put it on for 10 seconds to 20 seconds, test it, and test it in a spot there is not a high rosacea area. But we do have some rosacea patients using it. It's just not going to be for the 3-minute time frame. Absolutely. There are 50+ treatments in the bottle for VersaPeel. And this is the bottle right here. It comes in a 3-ounce bottle. If a patient has, it was developed for aging, acne, cystic acne, and melasma. So we have a really good reduction of melasma and pigment. If a patient has cystic acne, they are going to use just a pea size of the product on their skin. There's 50+ treatments in this bottle. It does come with an applicator brush, but if they have cystic acne, it's going to be 125 treatments. So it's going to be great for those kids that maybe feel this a little too much. But a little pea size on the skin for an acne patient is amazing. The skin lighteners also help to reduce scarring, which is typically associated with acne. So you have the salicylic that's going to work to help to reduce the P bacteria, and then you have glycolic that's going to exfoliate the skin, in addition to the skin lighteners. How does that feel?
Feels great.
Okay, good.
Smells pretty good too. Yes.
Okay, good.
After about a few seconds,
Okay,
it started tingling a bit,
Okay, good.
but not uncomfortable at all.
Great.
Feel the guard. You don't feel anything now? Or does it feel
No.
burning or anything? No?
No, it feels, should I say, maybe like alive. You know, it's no burning, no tingling, just very, very clean.
And we have some samples here on the table for those that have not gotten one to try that. So you can apply other topical treatments after VersaPeel. You use those in the office. You can apply your vitamin C's or hyaluronic acids. We also have a stem cell growth factor product that can be applied on top of that as well if you're just doing a VersaPeel treatment or facial at home. Right now we're going to show you a really neat combination therapy that our electrolysis are doing in the offices. This is VersaPeel, and now we're going to be doing the cool lifting device. Cool lifting is developed by a company called Cryo Concepts, and they are the leaders in cryotherapy in the United States.
That was scary. Sorry. Sounds like a laser machine.
So we're getting the little device ready. Pam, can we see this, what it looks like? So this is cool lifting. It has a CO2 cartridge in the back, and it has the hyaluronic acid in the top chamber. This company will also have multiple modalities instead of hyaluronic acid. There's a stem cell coming out, so you'll be able to blow and use other different concoctions of products out onto the skin.
All right, it's going to count down.
It's a little loud as we get started,
Ready?
but then you'll get used to it.
3, 2, 1. Here we go.
So this is an actual 4-minute treatment. The cool lifting device is taking the skin to negative 36 degrees. CO2 is blowing cold air. It's releasing the hyaluronic acid out of the skin. Also, the CO2 is creating a thermal shock to the skin. It's stimulating collagen. The charge for this in the office is around 175 to 250, depending on where you're located. We usually sell it in a package. It's a package store. Okay, so we come in every 3 weeks. What do you charge in the office?
It's great for sculpture. It's good after they start their sculpture treatment. Because it helps increase our collagen buildup.
Bundle them. Easily bundle them. They'll buy an initial package, and they'll start coming in every month and a half, and then it'll go out every 2 months. Yeah, how often is the patient coming back in? Once a month? And you can already see, you know, the hyaluronic acid that's on the skin is very nice.
No, you continue until the gun will shut off. Basically, there's still carbon dioxide in there. So this serum's going to run out here. Actually, I think it's going to run out.
You can hear it now being,
So there's 40 seconds left.
now we have CO2 that's just, CO2 is still very important. It's creating thermal shock, it continues collagen, it's also helping to dry some hyaluronic acid. So it's time for you to stop. And it has a base that it sits on, so when it stops, it goes back to base. And that's the charging station.
4 minutes, yeah.
So today we did the cleanse skin, we did versatile for 2 minutes, and then 4 minutes. So within 10 minutes. And it is beneficial to exfoliate the skin before you do a treatment, right?
Yeah.
Versatility is very cells. Absolutely.
20.
Hey, awesome. Wish the body would feel like that.
You and me both.
20 years younger, if not
Cost
a
for the
day.
patient is between, depending where you are, 150 to 250. So it's about 150 to 225 depending on location. Miami and some places obviously a little more expensive. This is a really cutting edge, no downtime treatment that patients can see an immediate result, and then they go home with beautiful skincare products that work, right? And everything that we want to do, we've been in the business, right? We're all trying to make a change in skin, trying to make a difference in a full range of skin types and skin indications. And this is something that everyone can do.
Everybody, rosacea.
And that's what's beautiful about it. Now, Pam, what do you say if a patient's on Retin-A? Do they need to get off their Retin-A before they do this treatment?
No, not before the cool lift.
Triluma, anything like that? Okay. Beautiful. There's really no contraindications. So that's another beautiful thing.
And then you just leave it.
So this is going. So what are the expectations, Pam?
So she should find that these little fine lines, you can already see that they've softened up
Okay.
here. See, can you see how they've softened up? And in the next couple days, they're going to soften even more, which is going to be great.
Is this
So
her skin? Is it going to look more shellac? Is it going to look glow? Is this going to soak in?
This is going to soak in, and then her skin is going to feel really hydrated.
It does get a little bit tight. You feel it a little bit tight. You can feel it work.
Yeah.
You get the firming effect. You get the tight. You get the glow, and then the glow. Because right now it looks wet, but this, after 15 minutes, that wet look goes away, and it looks like a nice glow. You could go just so out to dinner
like that. You don't
It's
wipe it
fabulous.
down. Pat
Well,
it
I'm
off.
massaging it in right now, and this is gonna make sure her skin absorbs whatever it needs to absorb. And then normally I would put some sunscreen on her too after.
And the patient could go home with Hyalocell GF, which is a stem cell from PriyanaMD, or they can go home with a cleanser. We have packages of the products that they can go home with, and the patient's not going to experience any pain. They can use their products that night and go into their nice skincare regimen.
Right.
And this is just jump starting the regimen, right? Which is nice.
So what does it feel like? Is it heat sensation?
No, it's cold.
No.
If you touched your skin right now,
Feels very comfortable and cool.
yes. If you were to touch her skin feels cold.
But what was because of the cooling device that you were blowing onto the skin? But what's the other part to it? Because it seems like
There's a serum that's getting infused into her skin.
the serum.
Yeah, a hyaluronic serum.
Okay. And does it
So-
stimulate?
It stimulates
penetrating
collagen.
like that? Okay.
Basically, what it does is it creates a thermal shock. So it tricks your body into thinking there's an injury and sends in the messengers that she needs to have. Sorry. Can't multitask, huh? It sends the message that, oh, there's damage, there's injuries, we need to build collagen here. So while it mimics the injury, it doesn't actually cause injury. So there's no downtime.
Are these the ones you said everybody can try?
Yes, so these are VersaPatch by PriyanaMD. These are silicone, Arnica Montana collagen patches that you can wear. You can walk around with them on.
How's that feel?
So you can watch TV, you can watch TV, you can do your laundry, and these are going to help to soften out lines and wrinkles. These are going to help, and these are retail.
And her skin's absorbed the serum now. She's done a really good job.
Hildegard, how'd it feel?
Awesome.
Good.
It looks so nice.
So she'll
Feels
leave
very
VersaPatch
great.
on for 20 minutes, and this is going to help with some of the dark circles and things like that. Well, thank you so much for joining our live. We appreciate it. If you have any questions, go to PriyanaMD.com.